We took a unique approach in the development of the curriculum. We decided that it was important not only to just talk about the kind of unique facets of race and culture in a health department environment, but it was important for folks to be able to be trained and learn areas that are broad brushstroke, if you will, in health departments. And so you might be a prevention expert, but we felt that prevention experts are going to need to have care expertise if they are ever to become an AIDS director, for example.
What NASTAD can bring to the table is an open and comfortable and safe space for the practitioners, as I refer to them, to be able to look boldly at the issues that are challenging them.
One of the unique things about the Minority Leadership Program is that it enables people from different states, from different levels of HIV incidence and prevalence, and different health department systems to learn from each other, to learn from senior leadership within health departments about what the role of a leader is, what some of the core competencies of leadership are, and then to be able to support each other, teach each other, and learn from each other over the next 2 years.
During any period of growth, I think that individuals find it the toughest when there is a mirror in front of you.
Each of them will have an opportunity to kind of what Kurt Lewin used to say, freeze, look at oneself, figure out an action plan for how I can perfect those areas that I like to strengthen, and not worry about those that I can't do anything about, then unfreeze and go to work.
The Minority Leadership Program put that mirror back in front of me. And I have to look at that person every day.
Really, the piece that developed more for me was the vision. What the vision? So you don't just stop your work at your unit level or your desk level. You can start seeing big stuff.
In helping you to drill down to identify what is your passion and what is it that you want to do.
It was a really good experience for me because I was somewhat scattered about what I was doing. So that sort of in your face, what are you doing, why are you doing it, was very helpful.
I saw myself as a 4'11" sexy sister who was working as a leader to ensure that others who don't have a voice, that their voice is being heard through me.
It's not just viewing yourself where you are now and the position that you have now, but sort of stepping back away from that and evaluating yourself as an individual and what you have to offer the Department of Health as a whole.
I never really thought that my project was going to come to fruition, to be quite candid with you. My project was about implementing a symposium on African Americans and health disparities. I figured I was writing this paper, you know, they told us, you know, write this as if you have unlimited funding and whatever you'd want to do, that's what you need to conceptualize, and that's what I did. And it actually was implemented.
I was able to put 6 units inside the health department and to put 22 people together the whole year to work on the project, how to improve the access to care.
What was really great for me too was the ability to learn and work with more people within the Department of Health, to collaborate with other agencies and programs within the Department of Health and externally, and really understanding what it is that you need to do to be able to leverage resources.
I really enjoyed the tutorials, the webinars that NASTAD, the MLP presented, and I think that they were a very good opportunity to disconnect from my duties, what I needed to do, and this was just for me and my own edification.
The staff are excellent. One of the things that I think was very helpful was having cluster calls. They're very accessible. So if there were times when you were stuck, or if you just need a little push, or just being able to bounce things off of your fellow minority leaders that were in the programs was really also very helpful.
The cultural competency session, I thought that was really, really excellent.
I think that from the conversations as I've heard here, I have a lot of thinking to do about the issue of race and the issue of minority opportunities within government.
Just because I'm an African American doesn't mean that I know about all minorities, and even as an African American, there's so many different aspects of that. And then I think it's important to not just look at myself, but to be able to identify in some kind of way with other minorities.
When we talk about the development of minority leaders, when we talk about the opportunities, the challenges, when we talk about the need for us to have these discussions, and to recognize that everyone who participated was from all over the U.S. It wasn't concentrated in one area, but yet we had so many common themes. Speaks a lot to the work that we have ahead of us.
You never really think about how others may be, what they may be dealing with in regard to being minorities, and I don't know, you always kind of look at yourself as, I'm going through all of this, but then there's other people who are experiencing things that you couldn't even imagine experiencing.
So we had people from all over the nation, and it was a good group, and with different backgrounds, you know, medical background, physician, case managers, prevention, care.
It's very easy to get stuck in a rut and just worry about what you have to do, and there's so many things that have to get done day to day, and you forget that there's a whole network of individuals out there to help support you in getting those, in accomplishing your job, even if they are across the country or in Hawaii or someplace else.
It just felt very much like we were on a voyage of greatness.
And I think it was a very interactive program, and helped us to empower us and to say why we are not at this place and why not us. We can do better than we are doing now.
So I actually personally was able to take the leadership that I had, the knowledge that I received and I acquired, and put them into practice. And I continuously find myself going back to what I learned, just applying or doing a twist of things to make sure that we get the right results. And so personally, I grew quite a bit.
One of the things my boss says to me is that ever since I went through the program, he says, you know, every time you come into my office, all I see is dollar signs because I know there's something you want to work on. But he's also said something else that was interesting to me. He said to me that you were very different before. He said, not that you were ever disrespectful, he says, but now you have no qualms in asking for certain things. And if it's no, it's fine, he says, but you will ask. And I think that's the other thing that has changed within me also. I'm willing to take that chance because it just may be a yes.
5 years from here, I don't know, but I would use the same tool they gave me.
It's really exciting to see that folks have really grown in a way and have been able to tap into the voice that they felt like they didn't have prior by going through this program in a way that has manifested into upward mobility in a health department.
I still, you know, enjoying the new promotion, so I think it's a little early for me to start planning the next step.